Hello, my name is Patty Ron. This is the health and wellness video for the workbook Aging in Place, Your Home, Your Community, and Your Choice. As you might guess, in order to stay in one's home as long as possible while aging, it's important to maintain our health and well-being. Seeking out information and services that support wellness can make a difference in the quality of life that we experience. This section of the workbook covers 3 key areas: making wellness a priority, understanding health insurance, and finally, using advanced directives to make sure that our end-of-life decisions are followed if we should be unable to communicate. Taking the time now to anticipate your needs regarding health and wellness could make a major difference in your ability to stay in your home in the future. Here's Dr. Sarah Gilbert, a nursing professor with extensive experience in helping older adults age in place.
My name is Dr. Sarah Gilbert, and I'm Assistant Professor of Nursing at Radford University. Today I'm going to talk to you about health and wellness and aging in place. I can tell you that I've worked with older adults for most of my nursing career. The last few years of my nursing career, before I started teaching, I actually worked at a community where older adults live and play. So I'm very familiar with the challenges that older adults face as they get older and want to stay in their own home. Today's topic is going to be health and wellness. I'm going to tell you some tips and things that I believe will help you be able to age in place better. A lot of this information is included in this Aging in Place workbook. It has a lot of good, more detailed information than what I'm about to give you. The first topic I'm going to discuss is health. How to maintain your health or how to improve your health. The first thing that you need to do is make sure that you visit your healthcare provider on a regular basis. You need to follow their instructions, make sure you have questions prepared if you want to get some answers, and also make sure you take a list of your medications with you. Another thing you need to do is talk to someone, if you need to, about your medical insurance. Whether you have Medicare, Medicaid, or supplemental policies, you can contact the Agency on Aging to help put you in touch with someone who can discuss these issues with you. What insurance covers, what it doesn't cover is important for you to know when you start visiting your healthcare provider or specialists. My next topic is going to be wellness, your wellness, and your ability to remain in place in your own home. The first thing I'm going to talk about will be how to continue to keep moving in your home. It's really easy for us to relax into that chair or sit on the couch or lie on the couch and spend the day watching television. Unfortunately, as we get older, our joints become more stiff and our muscles lose their power. So what you want to do is move. At least every hour, try to get up and walk around your house, go outside, go check the mail, go get the newspaper, take the dog out for a few minutes. This doesn't have to be an hour-long event. It can be as short as 10 minutes, just moving around. If you're able to take stairs, use the stairs. When you park in a parking lot, try to park further out in the parking lot if you're able and walk into a store. The more exercise or the more walking that you do, the better your health will be. It's so important for you to keep moving, just as it's important for everybody to keep moving, because that's how we stay in our own place. Some final thoughts about health and wellness. One of the things that I encourage my patients to do is to plan ahead for the inevitable. One of the things is to look into completing advance directives. There are 2 pieces of advance directives. One is a living will. A living will is a document that lets people know what you want and do not want to have happen if you cannot speak for yourself. It's important for people to know our wishes because if left up to others, we may experience an end of life that we did not choose to have. The other part of advance directives would be a medical or durable power of attorney. This gives a family member or friend the ability to sign papers, make decisions, and talk to healthcare providers about our care and what our wishes are. I cannot stress to you how important these documents are. There have been many times that I have been in the hospital where patients have not completed these documents. And even though I knew their wishes were not to be on a ventilator and were not to be resuscitated, they did not communicate that with their children. And so they were on a ventilator and they did have CPR done to them. So their last moments and hours were in a hospital room, not surrounded by people that they loved, by strangers.
If you turn to the health and wellness section of your workbook, you'll find information that will help you make plans for the future. Having the plans will help ensure to the extent possible that you are able to stay in your own home for as long as you can. Having the plans will help you avoid having to make hasty decisions if your circumstances change abruptly. That can save many hours of searching for information and answers during a crisis. Actively planning today helps provide for a more satisfying future. Thank you for joining us. Be sure to check out the other topics in this video series.